Hip replacement and dementia patients. Seniors with dementia are at increased risk for hip fractures and hip replacement surgery. Caregivers of dementia patients undergoing hip replacement surgery can help minimize complications and aid in recovery by paying attention to changes in behavior. The intersection of hip fractures and dementia in elderly patients presents a complex challenge for healthcare providers and researchers. With an aging global population, the incidence of hip fractures and the prevalence of dementia, notably Alzheimer's disease, are on the rise. This video delves into the multifaceted relationship between hip fractures and dementia, exploring various aspects from the initial injury and surgery to the post-operative care and long-term health outcomes. Hip fractures and dementia, a growing concern. Hip fractures in elderly patients, especially those with dementia, represent a significant challenge in public health, as emphasized by the World Health Organization and other health bodies. The gravity of this issue lies in the high morbidity and mortality rates associated with hip fractures, which are a frequent occurrence in elderly populations. Elderly patients, especially those with cognitive impairments such as Alzheimer's disease or mild cognitive impairment, are particularly vulnerable to hip fractures due to several risk factors. Increased risk in dementia patients. Patients with dementia, including Alzheimer's disease, are at a higher risk of experiencing hip fractures. This elevated risk can be attributed to several factors inherent to dementia conditions. Reduced mobility. Dementia often impairs motor functions, making patients more prone to falls, which are the primary cause of hip fractures in the elderly. Impaired judgment. Cognitive decline affects judgment and spatial awareness, increasing the likelihood of accidents leading to fractures. Overall frailty. Dementia often coexists with other age-related health issues, compounding frailty and vulnerability to fractures. The complexity of hip fracture surgery in dementia patients. Undergoing hip fracture surgery presents additional challenges for patients with dementia. Their pre-existing cognitive impairments can exacerbate post-operative complications, leading to longer hospital stays and increased in-hospital mortality. The outcomes of such surgeries are closely tied to the patient's cognitive function and the quality of the hospital nursing care environment. Systematic reviews and randomized controlled trials. Research, including systematic reviews and randomized controlled trials, has shown that dementia significantly affects the outcomes of hip fracture surgery. These studies highlight the need for specialized care and tailored medical approaches. Individual characteristics influencing health outcomes. Body mass index, BMI. BMI plays a significant role in the health outcomes of hip fracture patients. Patients with either low or high BMI may experience different complications or recovery trajectories post-surgery. Severity of dementia. The degree of cognitive impairment, whether it's mild cognitive impairment or severe dementia, significantly impacts how patients respond to hip fracture surgery. Those with more severe dementia may have poorer outcomes. Cognitive function. The pre-existing level of cognitive function in dementia patients is a crucial factor. A decline in cognitive abilities post-surgery is common and can complicate recovery and rehabilitation. Institutional factors. Hospital nursing care environment. The quality of care in hospitals, as indicated by factors such as nurse staffing levels and the presence of advanced practice nurses, directly impacts outcomes for hip fracture patients. A supportive and well-staffed environment can lead to better management of post-operative complications and overall care. Hospital bed availability and acute care facilities. The availability of hospital beds and the capability of acute care facilities to handle complex cases like hip fractures in dementia patients are vital. Overcrowded or under-resourced hospitals may struggle to provide adequate care, leading to poorer outcomes. Regional medical care system. The broader healthcare system, including the integration of acute care hospitals, community medical services, and post-hospitalization care facilities, plays a crucial role in managing the continuum of care for these patients. Research and studies. Retrospective and prospective cohort studies. Research studies have consistently shown that dementia patients suffering from hip fractures often experience a decline in both cognitive function and overall health status after surgery. These studies help in understanding the risk factors and outcomes, guiding better treatment protocols. Systematic reviews and randomized controlled trials. Such studies provide evidence-based insights into the effectiveness of different surgical and rehabilitation approaches for hip fracture in dementia patients. They help in identifying best practices and areas needing improvement. Healthcare quality and outcomes. In-hospital mortality and post-operative complications. Dementia patients undergoing hip fracture surgery are at an increased risk of in-hospital mortality and post-operative complications. Factors like the patient-to-nurse ratio and the quality of acute care can significantly affect these outcomes. Healthcare quality and ethical considerations. High-quality healthcare, aligned with ethical standards and focused on the unique needs of dementia patients, is essential. This includes making informed decisions about scheduled or emergency surgery, balancing risk factors, and ensuring patient dignity and autonomy. The impact of hip fractures on health outcomes in patients with dementia is a complex issue that requires a comprehensive approach. Addressing individual patient needs and enhancing institutional capabilities are key to improving outcomes. Continuous research and adherence to high standards of healthcare quality are essential to cater to this vulnerable population effectively. As the prevalence of dementia increases, so does the importance of optimizing care for hip fracture patients within this group. The role of medical and nursing care systems. The regional medical care system, including acute care facilities and general acute care wards, is integral in managing hip fracture in dementia patients. The quality of healthcare, ethical and legal considerations, and medical service fee revisions are all crucial in determining the level of care these patients receive. Institutional factors like the patient-to-nurse ratio, registered nurse staffing levels, and the presence of adequate post-hospitalization residences play a significant role in determining outcomes. Studies have highlighted the need for appropriate medical care tailored to the needs of dementia patients. The increasing prevalence of dementia and hip fractures in elderly populations calls for a reevaluation of healthcare strategies. Encouraging hospital discharges to suitable care environments and ensuring continuous, specialized care are essential. The relationship between dementia and hip fracture outcomes underscores the need for an integrated approach in healthcare that considers not only individual patient characteristics, but also the broader nursing care and hospital environment. Thank you for watching. Don't forget to hit that subscribe button and ring the notification bell so you never miss an episode of Caregiver Relief. If you have any thoughts, ideas, or suggestions for future videos, topics you'd like us to cover, or even improvements you'd like to see on the channel, drop them in the comments below.